Our current research is focused on what are the best strategies to improve walking in people with a stroke or spinal cord injury. There's a lot of data that says that a lot of things can improve walking. We're trying to figure out what's the best thing. Being here at the Rehabilitation Hospital of Indiana, and my lab being right next door, I can get these findings and I can deliver them right to the therapist, and the therapist can then intervene, hopefully better, on their patients to improve their outcomes during regular physical therapy practice. So if we can intervene on the therapist and the therapist can intervene on the patient can get better gains earlier after their injury, and maybe instead of going to a nursing home, they can go back home and live in the community, and by continuing with more physical therapy, they can have even greater gains, maybe get back to work, back to their regular social activities, those types of things that they did before their injury. Hi, I'm Dr. George Hornby. I'm a physical therapist and a researcher at the Rehabilitation Hospital of Indiana and Indiana University. So my primary role in research is to focus on interventions that can improve walking recovery in people with spinal cord injury, brain injury, or stroke. And we use different strategies to look at how well they can improve, how much they can improve, and whether we can accelerate that recovery. So when we first started this research, I was really excited about some technology that we could use, these really kind of fancy robotic devices. Hey, let's get people up and walking these things. Let's try it. And when we were collecting the data, we were getting this data, and I was like, wow, this is really interesting. The device may not work as well. Maybe just having them walk on a treadmill. And then you keep on doing things, and walking on the treadmill is fine, but no one lives on the treadmill, so that's not working. Let's do over ground. And so we did more stuff over ground, and then we started doing the little more crazy stuff. And the more we collected data, the more I realized that what I did in the gym, what people will learn in the gym, and how to work out might be translated fairly readily to patients with stroke, which is really totally different than what I was taught in school and what most people are taught in school. So just like you would try to improve your ability to play piano, what would you do? You'd probably practice piano. We think that to improve walking, your primary goal should be to actually focus on walking therapy. And so we focus on walking therapy, but how you practice is really different. So if we think outside of our therapy box and go to other disciplines, say, how do they get better? Runners, how do you run better and faster? Well, you run hard, and you cross-train a little bit. So we're doing that here with our patients, and we're getting these great gains. With more research funding, we can help understand how patients after a stroke or spinal cord injury or brain injury can accelerate recovery if we intervene right after their initial injury, all the way through the recovery process. Funding from donors or donations during Giving Day, for example, can really help start a new program to get therapists excited about that. And so when they see this research and they're actually helping do it, and they say, okay, wow, this is really working with this patients, and then they treat their own patients for half the day. You're like, well, maybe I can try this on these patients. And that really facilitates translation. And if I can get them to then help the other clinicians who aren't in my lab, who work with patients, then we've got a bit of momentum. And then we get these interventions really going. And then it sits here, but then we want to spread it to elsewhere. So those are the kind of processes that I work on, which I fell backwards into those things because I didn't expect that to happen, but that really might be one of the more important pieces to facilitating translation. One of my big goals in research is to get the findings that we have in the laboratory and put it in the clinical setting. We feel that really high-intensity walking interventions. You go to the gym and you see those charts and say, this is the rate I should work at, and you're down here. We're trying to push people way up there. And what's important is they can improve their function not only in our laboratory in a nice controlled environment, but we put little sensors on their legs like Fitbits, and we measure them out in the community, and they're doing a whole lot more out there. They're going to church, they're going back to work. And those are the outcomes that really matter, getting them to do the things that they want to do after their stroke that they did before their stroke. But just on the personal level, you have a guy who's living in a nursing home who has no more therapy. What else is he going to do? He can't even sit up on his own hardly. And you get him in research, and he's able to walk on his own and get out of the nursing home and go home and get a job and go back to school and have a girlfriend. Those are important things. And then you have the guy who was a runner before his stroke, and he just had a random stroke. And we have him do these crazy things like walking up 2 stairs at a time. And he's like, I'm going to try to get in some races. And he starts doing these mini marathons. And that was something he never thought he would do. And so those are the really cool stories about research. that I think that clinicians can do that if we just apply that, and implementing these strategies is really important.